Hi everyone, it's Joanne from Aberdeen Home Care, and today we're talking about what if you're sick? What if you think you need the attention of your healthcare provider, your physician, or you have a medical problem that's just come up, or you have worsening of an existing condition? Does this mean that you should just kind of sit on it and hope it goes away until the coronavirus quiets down and life gets a little bit back to normal? Or should you be pursuing answers to your questions? Well, I'm going to vote for part B, answer B. That's going to be my double jeopardy question for the day. Call your healthcare provider. What you need to do is provide data. I don't feel well doesn't really help them to diagnose you or figure out where to put you in the triage line about how to get your problem solved. Here's my temperature. If you have a blood pressure issue, here are my numbers. If you have a blood sugar issue, here are my numbers. Being very specific, making your list of symptoms before you call the physician's office, because what you want is effective treatment. And without information, they really can't give you effective treatment. So if you feel you need to be seen at the doctor's office, if a telephone call isn't going to work, or if you don't have a device, you're unable to do a telemedicine visit with a smartphone or a family member or a laptop, then you probably need to go in and be seen by the physician or nurse practitioner or physician's assistant. And so you're going to make an appointment. Most physician offices have clean and dirty areas. They're very aware of separating people that are coming in with COVID symptoms. In fact, I think a lot of physicians' offices are not seeing COVID symptoms in the office. They're directing them to get a test. And so all of this is being handled outside of the offices. So I don't want you being terrified thinking that you're really going to be terribly exposed by going to see your doctor. A lot of physician offices have different entrances, and they're taking people in a different way and going right into an exam room and not going to a waiting room, bypassing all that exposure. The other thing is, if you take care of your issues, then you may be able to avoid an urgent care setting, an emergency room, or an admission to the hospital. Now, even with saying that, I know that the Boston hospitals have got things well separated. They have COVID positive floors. They have COVID negative areas. They're really trying to keep areas clean and separate from people who have the contagion of COVID-19. Even locally on the North Shore, inside of the Leahy system, they have designated facilities that are clean, not accepting COVID patients, and facilities that are designated for COVID patients to try to keep it separated. So the medical community obviously is responding to this in a huge way, but the one thing you don't want to do is sit at home on symptoms that could be problematic. Maybe you've had chest pain for the first time. Maybe you think you have a urinary tract infection. Whatever it is that you think deserves medical attention, it does. Listen to that voice. Talk to those in your family. Ask for support. Call your physician's office. If you go to aberdeenathome.com, and that's aberdeenathome.com, there's a list that you can print out that gives you very specific directions about what to ask when you call your physician, your healthcare provider's office, and what to expect in return. And you can just print that out. So again, I'm directing you to aberdeenathome.com. As well, on the website, there are some practical tips for self-care inventory and managing anxiety during this time, as well as a host of other things related to the virus, protective measures that you can employ to stay healthy and to be able to allow that amazing immune system of yours to do its work and protect you from COVID-19. So if you're sick, please call your doctor, your healthcare provider, and let them direct you to what's next. Please do not sit at home with symptoms that need being addressed, or you might end up with a bigger problem. Until we talk again, please take good care, and we'll see you soon. Bye.